In 1978, Dr. Scott Morris was in the chaplain's office of Yale Medical School when he noticed a pamphlet, How to Start a Church-Based Health Clinic, by Granger Westberg. At that moment, he knew what he wanted to do with his life. The next summer, he spent several weeks learning from Granger, and because of Granger's inspiration, he would go on to found the Church Health Center in Memphis, Tennessee in 1987. Recently, Dr. Morris sat down with Granger's daughter, Jill, to discuss her father's vision, the impact of the Church Health Center, and the future of health ministry and faith community nursing.
I got this tour of the health center today, 2-hour tour. Well, first I had really scoped it out on your website, which is remarkable. And so I had a good idea what I was coming to see. But to see all the people you are touching and that can afford to come to a place like this, to be in a fitness center that's a state-of-the-art, that's making a difference in their lives, and is not just an exercise class. There's the whole person is involved and the community is involved. I like it. Churches are one of the few institutions, if not the only institution, in our country that see people from before they're born till after they die and care about them during all that time. They also see the person in context of their family. They see them, unlike a doctor, when they're healthy as well as when they're sick. So when you're not doing well, it's important to know a person's strengths. You know, what do you have to bring to the table that's going to help you get better? So the church is it's natural for this. And in the church, you've got people of so many different backgrounds. You're going to have the medical people, maybe. You're going to have carpenters. You're going to have nutritionists. You're going to have people who just are interested in caring for others, people who knit shawls, whatever. Get them involved and get to be a coordinated effort. The churches have for years and years, for centuries, have always been caring for people in healthcare. Taking food to the sick, helping out at homes where people need some extra care. But we can do more. And we can do it in health-related things as well as caring for them when they're sick.
This whole idea of health and wholeness is something that you can grow a church by. That this is an evangelism idea. Churches need to have health ministry just like they need to have good Sunday school, good preaching, good fellowship. If a church embraces this, it is very much what people need and want in today's world, and it is something that will grow any church. The Church Health Center very much claims our inspiration from your dad, and now that the IPNRC has been embedded in the work of the Church Health Center, and I think has found a home for years to come. Both how do you see it, and how do you think your dad would see the Westberg legacy living at the Church Health Center?
I think my first impression is I think he would be thrilled, in part because his original vision was to bring all these teams of people together caring for people. He loved the parish nurse, and that's the idea that lived on, but he started with a holistic health center. And he just couldn't make it go financially. And to see this place that isn't just one doctor, one nurse, one pastoral counselor, but doing really whole person care, because you're really doing the fitness end of it too, the nutrition, and caring for people who need the care. He would be just exuberant.
Great. Well, I can give you our assurance that we will stick to those principles. We're not going to change. We're going to do everything we can to engage the church and people of faith around what the church is supposed to be doing.
Yeah, and now we'll do it on a larger scale.
Yeah, absolutely. In Memphis, there are now hundreds of churches that actually embrace health ministry. 25 years ago, I don't think you could say that.
Wow.
The Church Health Center has been replicated at some level in dozens of cities around the country. And I really do think the opportunity around the IPNRC living at the Church Health Center is over the top. Yes, we have got 15,000 nurses who have received the training, but what we believe is the opportunity to go to seminaries and to go work on the church side of this is really great. In getting the church to understand the need for having parish nurses is something where there's a lot of opportunity, and we're seeing a lot of receptivity.
Wonderful.
At our medical clinic, we provide quality, affordable health care to working, uninsured people and their families. Our 80,000 square foot comprehensive wellness facility, Church Health Center Wellness, is a certified medical fitness facility. Our innovative, high-quality programs are designed for all people and all walks of life. Our goal is to teach people how to live healthier, more joy-filled lives. Our faith community outreach team cultivates relationships with individuals and congregations to encourage, educate, and equip people to build and sustain healing ministries. To learn more about the Church Health Center and our work, visit churchhealthcenter.org.